Bovine rhinotrecheitis. It is also known as red nose. It is a highly infectious disease of cattle characterized by pneumonic form. Then it also affects eyes, causes abortion, encephalitis, and vulvovaginitis. It caused by the herpes virus, that is also known as bovine herpes virus. It causes 6 to 12% mortality in the beef cattle and 3% mortality in dairy cattle, and also causes considerable amount of morbidity. The transmission is most commonly observed through inhalation, but through contact and through natural service or artificial insemination, the transmission is observed. Upon entering into the respiratory system, it starts pathogenesis. It causes rhinitis, laryngitis, and tracheitis. Further, it sets up viremia. Then it localized into the respiratory tract, followed by the eyes, and it also targets the vagina and vulva. The virus also enters into the nervous system. It targets the meninges, where it causes non-purulent leptomeningitis and encephalitis. Let us discuss the different forms of the disease. First is the respiratory form or pneumonic form. The incubation period is 3 to 7 days. It is the classical form of the IBR. It causes temperature up to 108 degree Fahrenheit, followed by decrease in the production. There is anorexia and depression. The mucosa of the nostrils, they are severely congested, they become pink. That is why it is known as red nose. Pink-red color of the mucosa is observed. Then nasal discharge is seen in the beginning, and then it becomes mucopurulent. Then finally the disease is converted into severe pneumonia, and finally open mouth breathing is observed due to heavy congestion of the lungs. Eye form, initially it starts with the conjunctivitis, then followed by serous discharge in the beginning, followed by mucopurulent discharge. It also responsible for the corneal opacity. In the abortion form, about 25% of the pregnant cows can abort, and the aborted fetus, if they comes alive in live condition, then they may survive for a very short time, and then after they died. The encephalitic form, the calves up to 6 months of age, they are mostly affected. The neurological signs are observed: salivation, incoordination, circling, convulsions, blindness, and recumbency. In the systemic form, generally all sort of mixed symptoms are observed in this form. Then the pustular vulvovaginitis form. In this, the mucopurulent discharge, pustules, and white necrotic material can be seen on the mucosa. In the bull, it causes severe balanoposthitis with IBR lesions. The bull get infected during the coitus if the female is suspected. Then the differential diagnosis, it should be differentiated from the BVD, rinderpest, then malignant cattle fever. Then treatment, only the good nursing care, then a course of broad spectrum antibiotic to reduce the respiratory distress and coughing. You can administer the expectorant and the antihistaminic like Avil. For the eye form, 2-deoxy-D-glucose at the concentration of 20 mg per ml has been used. You can use it twice a day as an eye drop. Then prevention and control, the general hygienic measure has to be adopted. Then vaccinations, the modified live vaccines are available that should not be used in the pregnant animal. Then in India, IBRT vaccine is available, that is manufactured by the Intervet Lab Hyderabad, and the dose is 2 ml subcut, and the duration of the immunity is 1 year, as it is repeated annually. Thank you.